triangle. So it's aged people. And the part of the prostration is coming down the inguinal canal, may enter the scrotum. I mean, the indirect hernia could be into the scrotum, and by Hasselbalch triangle, it won't get into the scrotum. And the shape of the sac means the indirect hernia is elliptic, and this is all like semi-spheric, have a wide base, because one is go out from the deep ray. The deep ray is very small, so it go out like a pear. And another is, I have told you, compress, control the internal ring. So if you control the internal ring to go out, it's indirect. And if you control the deep ring, still go out, it's direct. And the relationship to the spermatic cord of sac, one is posterior to sac, another is anterior to sac. This is not important, sometimes not the case, but it was described here. And then is the relationship to the inferior epigastric artery is the indirect is lateral to the inferior epigastric vessels, and another is medial to the epigastric vessels. If you know the anatomy, it's very easy to understand. And another very important is the indirect hernia, because they go out from the internal ring. It's very small region, very small orifice, so it's easy to gauze, incarcerate. And for the direct hernia, the weakness is always a triangle. If you remember, it's a very large one, so it usually won't cause incarceration. So this is the difference between indirect and direct hernia. I think you must remember this table. This must be remembered. This will be tested. So, for the treatment, I think it's easy. For small child, I think you have just give a question. Why the infant who less than 1.5 kilogram is a risk factor? Means people less than 1 year old always have chance to heal the hernia by themselves, because the inguinal region is still under development, so it's impossible to heal. So you never do operation for maybe less than 1 year old, because maybe you can heal themselves. And the other is very elderly patient is really diseased, really ill, too sick to get a operation. So for this patient, use the trust. It's okay. And now we turn to some procedure, surgical procedure. I mean, if you know the anatomy of the inguinal canal, it's very easy for you to understand. There are some different kinds of operation. One is tension-free repair. Use some patch in the blood, because this is Liechtenstein repair, and then Bassini repair, McAvey repair, shoelace repair, and laparoscopic hernia repair. We'll talk about one by one. So this is the basic method of repair. This is Bassini repair. The Bassini repair is very, very basic. Usually, I think 10 years ago in China, most of us, when we repair the hernia, we use Bassini method. So this method is easy. The red one is conjoined tendon, and this one is inguinal ligament. So we need some interrupt the suture to put the inguinal canal, inguinal ligaments and conjoined tendon together to eliminate this space. And this is the spermatic cord. So 1, 2, 3, just to eliminate this space. So to repair this method. So I have a question. If you can understand this method, it's very easy for you to understand the following method. So if you have any problem to this method,
so we always just suture the gap.
Suture the gap?
Yeah.
What's the gap?
It is like the space to which this hernia is going, right? So So we always suture it. That's it.
Yeah.
Why do we have a lot of
Right.
types?
When you, I mean, you just only ligation the sac,
Yeah.
you mean, and then go put this back.
Yeah.
Yeah, of course, this is the basic procedure.
That is known as dressing repair?
No. This any repair means first you must ligation the sac, go let it back. This is the first procedure. We call this is ligation of the sac. Then you must make repair. Otherwise, some days later it will go out again because the defect is still there and the etiological factor is still there. So if you do not make a repair, that will cause problem. I think one week later or 2 weeks later, to go out again because the effect is there, the hole is still there. So this is the basic method. Make you please must remember, or must keep this in your mind. Basically, repair is put the conjoint tendon and inguinal ligament together. We go back to the anatomy very fast. Go back.
Screw them up.
I know this one. Okay. Go back. So you will see here, this is conjoined tendon. Of course, first you dissect here. You put the hernia sac should be here. Hernia sac, and put the contents back to the abdomen and make ligation of the sac, and then use your finger to put the sac go back to the abdomen. Then you must do repair. The repair is conjoined tendon and the ligament to close them. There's a space here. You close this space beneath the spermatic cord. So to finish this repair. So, but here I will point out some problem of this method. Spermatic cord this close was beneath the spermatic cord. The spermatic cord is still there, and this problem caused some problem. Is one thing is, the ligaments and the tendon. This conjoined tendon is muscular layer, and the ligaments is just aponeurosis, the thickening of aponeurosis. This is two different tissue, and you use your suture, put two different tissue together. It's very difficult for them to recover. This is one thing. Another thing is, this potential, this is space is an anatomical space. It's not, it's not a physiological. It's not a defect. And you put these two things together, it means there will be tension. You put two things together, it's very difficult. The patient will be painful because of this tension. In China, there's an idiot. We call this 强有的刮不甜. You understand? Yeah, it's very difficult. Yeah, you just like marriage, the wife and the husband. You look. This is a wife. This is husband. They are not naturally together. You use your suture, put them together. They want to divorce. So this is basically repair. It's a disadvantage of classical, but it's still very clever. The inventation is very, very, very clever. I think put them together. I think 10 years ago, it's a very successful operation, and most of the patients did not get recurrence. The only problem is will cause pain and recurrence, and sometimes because you make a suture here, it will cause this is the spermatic cord will cause swollen of the distal part because of the venous contact was impaired. So this is one operation. And then another one is McAvey repair. McAvey repair is not important, but if you can remember some idea, it's similar to the back knee repair. The only thing is the conjoined tendon was suture to not suture to the inguinal ligament, is to Cooper's ligament, which is a deeper ligament in the beneath the inguinal ligament. So remember this. It's okay. We won't talk about more. And another very important is Ferguson repair. The Ferguson repair is also easy because this is inguinal ligament, this is conjoint tendon. The only difference with Bassini is it's anterior to the spermatic cord. So actually the spermatic cord was beneath. It won't cause congestion of the testicle, but it do have some problem. It's not control the deeper ring. The deeper ring was not affected, so it's not very not used very often.
What is that?
You know. So now I will.
What is the problem with this?
You see here. You see destiny. First I show you destiny. You know, there's a suture here. You know, this suture is very important because you know the deeper ring is here. So you make a suture here. It means that there's usually in these people the deeper ring because of the hernia become very large. So you make a suture here. This suture is critically important because it shrink the deeper ring, control the deeper ring. So it won't go out very freely. But for this method,
There is no ring.
yeah, for this method, you know, although it feels not painful, but the deeper ring was not controlled. So this method only used in patients with no defect in deep ring. The patient maybe have a problem in this way, not in deep ring, you know. So it's repaired anterior wall of inguinal. So somebody will ask you which is the method that is controlled anterior wall of the inguinal canal. That is Ferguson.
But this is for direct hernia.
For
Direct hernia.
Both work for direct hernia.
Indirect. Because indirect involves both the deep ring and the interior ring.
it depends. The direct hernia. There's not like this case. You know, in very few cases of indirect hernia, although it go out from the deep ring, but it is still not, the defect is not so large, so it can use Ferguson. So we seldom use Ferguson. You know, the Ferguson was not used. Very rare used. So, but there's such a term there, so I have to explain. You know.
Actually, this method should be the best method.
Wait. Do you think it's best way?
Yeah.
No, I will show you the best way. It's not the best way. So and another is shoot is very difficult. I won't. So we turn to I think a better way. Now a better way come out. I think you know. I have shown you two disadvantages of Bassini. One most important is tension. The tension is one of the most important problem of divorce. So, you know, actually, Liechtenstein, I don't know, maybe it's Germany.
Liechtenstein.
Liechtenstein, yeah. So, this is a tension-free repair. He used a mesh, you know. Look, it looks just like Bassini. So if you know Bassini, everything just derived from Bassini, you know. So this is conjoint tendon. This is inguinal ligament. He did not use simply suture. He used a mesh here in between. A mesh in between. Looks like this. And then, so this is mesh. And this is a plug. He put the plug. This is deep ring. Here a deep ring. Put the plug into the deep ring. Two methods, two things. One mesh, one plug. Then we call this is tension-free repair. This repair and this material is very interesting. It's a mesh and then put into the skin. The scar will, the fibrotic tissue will grow into the mesh very fastly. 1 or 2 days later, all the scar has get into the mesh and become a very strong barrier here, very strong barrier here. And the plaque, also the tissue will get into the plaque, and also this is very easy to control the deepening. So this method derived from the Bassini repair is the very common in China, because this is also around the world. I think the worldwide the using of Liechtenstein's repairs, so it's a very important repair. We did not use Bassini anymore. Very rare case for patients. They have infection or something like strangulated hernia because of the necrotic testing or something. We cannot put the foreign body into the incision. So in this case, we did not use Liechtenstein, but we only use RCD for just simply repair. For any other case, we just use Liechtenstein repair. So please remember, it's very
How much
important.
this mesh cost?
How about this cost? Expensive, I think. In China, it's 2,000 yuan. Yeah. I don't know. It depends. Somebody think it's cheap. Somebody think it's expensive. Depends. So,
Also, these methods, you didn't mention whether they are indirect hernia or direct.
yeah. Usually, for this method, if this is a direct hernia, you just use the mesh, it's okay. You needn't use plug, because the plug has to be put into the deep ring. It did not have effect in the deep ring, so you needn't use the plug. If this is a indirect hernia, you have to use the plug. It also depends. So, up to now, still many people is making research in this mesh and plug. They try to find out some very ideal mesh. It has some characteristics for this ideal prosthetic material, not modified physically by tissue fluid. It's one thing. Chemically inert, something not carcinogenic, and easy to be sterile and something. A lot of criteria for this material. Actually, now it's quite okay. But one problem for this operation is, one thing is cannot be done in non-sterile operation. If patient have incarcerate or patient have strangulation, we cannot do this. We have to wait and make a second operation for repair. This is one thing. Another is sometimes the patient still will feel discomfort because of this foreign body. I think maybe 100 or 1% of people will have this problem. They just complain discomfort, but don't know why. Maybe it has touched to the nerve or some other things. It's very difficult to explain.
She can take a break.
How about a break?
Well, I will finish this soon. Okay?
Okay.
So, yeah, this is the Liechtenstein repair. So, we come to the last part is laparoscopic hernia. Laparoscopic hernia. So, the laparoscopic hernia is very easy. I just show you 3 kind of hernia repair, and very easy. So, please forget IPOM, the intraperitoneal onlay mesh. It's all the from inside of abdomen cavity has been abandoned. TAPP also abandoned. Please remember, total extraperitoneal repair. It's okay. Somebody asks you how to make a laparoscopic hernia repair, you just tell them using TEP. It's okay. So this is three. And then we'll show you this one. See, this is the scope. Get scope in and down, and then use a blue inflated, and then you will see this region, and then inflated. Then it was inflated by gas. Then it gives a chance to operation. Look, this is what under the scope, laparoscope, looks like this. It's very easy to see, just like looking from inside of abdomen. This is what's this? Yes, here you see isosceles triangle, and here is the internal ring. You just put a mesh here, use some clips or some sample here. Then it's okay. The repair finished. I mean this repair is not outside. So no plug and no foreign body. Just peritoneal. It's very nice. So I think laparoscopic mesh repair is the best way. The only thing is you must have a total adhesion instead of continence.
So in this case, the deep inguinal ring you haven't done the deep inguinal ring. The deep inguinal ring,
Yeah, it's here.
is not plug.
Not plugged. Not plugged.
So
No, please remember. You imagine this. If you put things from outside, you must make a lot of, because the pressure comes from inside. So it's very difficult. You know, for example, you have a pool to wash basin. You have a pool here. You try to plug the hole in the bottom of the pool. From outside, you must use a lot of things. You know, use all the things to stop this, to control this hole. But from inside, you use a very small piece of things. It's very easy to control because the pressure comes from inside to outside. So this is the, I think, principle. So here we needed plug. Just use a mesh. So the femoral ligament, femoral hernia is easy. It's very easy. This is from, you just remember, it's from the femoral ring. Here, femoral artery, femoral vein, and femoral canal. So you know, if things go out from this way, it's beneath, it's inferior to the ligament, inferior to the inguinal ligament. Go out from here. So okay, and remember, repair is activate. You see, look at this. The repair is like this. We need it. Incisional hernia. It's very easy to understand. Some problems are always caused by poor nutritional status. It's very easy. Like this patient, it's very easy to cause because the incision cannot heal, so it will cause hernia. And another part, so another extremity, you know, tissue fat. I mean, obesity. Obesity is another kind of poor nutrition, you know. So although fat, under the poor nutrition is also easy to cause incision hernia. This is the old woman under the operation, you know. This is look like this. Before operation, look like this. After operation, it was repaired. And here, I mean the incision infection is one of the very important cause of hernia profile. Yeah. As to intraperitoneal access, I think it's very easy. It's really cannot explain by practice. You just remember. You know. You see here? All the organ in the abdomen was wrapped by peritoneum. We call this is visceral peritoneum. And here is parietal peritoneum. So any problem of this organ, like the abscess in the liver, perforation of the gut, or necrosis of the gut, all will cause intraperitoneal abscess. See? In this region. This region beside liver, pericardic space, pelvic space, they are all the lowest space in the abdomen. So it's very easy. The abscess was easy to accumulate here. So I think we want to test you here. And it's also important. What we talk about the major topic here is hernia. The hernia is difficult to understand, but abscess is something you can too, I don't know. No serious for abscess actually. You should learn in future in your clinical job. You will know something about this. So what you try to learn, master is the hernia. You know, all the things appear in this demo. I make the extra tests outside of this level. All things in this level. So don't worry about tests. We must let you pass.